Should New Hampshire set up a health insurance exchange? Coming up in the Cloakroom. Hi, I'm Grant Bosse, and welcome into the Cloakroom, the video magazine from the Josiah Bartlett Center for Public Policy. Should New Hampshire set up a health insurance exchange? Both the House and Senate grappled with that question this week. The Senate putting off debate over setting up the exchange, while the House Commerce Committee considered a bill that would block New Hampshire state agencies from setting one up in the first place. Representative Andrew Manus is the lead sponsor of HB 1297.
The exchange is the mechanism to enforce an individual mandate. It doesn't make sense to me. A state exchange does not increase autonomy or sovereignty. In fact, by implementing a state exchange, we voluntarily accept Obamacare and all federal rules that come along with it. According to the law, the Federal Health and Human Services Department could rewrite or dismantle our idea of an exchange and then force its own version on us. By that point, it will be too late. We will have accepted a state exchange, so we will be responsible for that state exchange. And what I mean by that is we would have to pay for it starting January 1st, 2015. We would not have to pay for a federal exchange under the current Obamacare law. Researchers have estimated that a state exchange could cost anywhere from $10 million to $47 million a year. Where are we going to get that money is the simple question. A state exchange is going to destroy the New Hampshire advantage. I can say that matter-of-factly. We can't afford it. The current legislature has already well-established position opposed to Obamacare and also opposed to implementing an exchange. The House has taken a position that we want to join the lawsuit against Obamacare with the other 26 states that have done so. The courts have argued, and when I say the courts, I mean the federal courts, have argued that you can't sue against Obamacare and then voluntarily join the program. That would be hypocritical. So with our House's intent to join that lawsuit, whether or not we do actually do so, it was our intent to do so, it would be hypocritical for us to move forward with a state exchange, which would do the opposite of joining a lawsuit. And you know, the courts are going to use that in their decision when it comes up in the Supreme Court in March. You know, why are you trying to get out of something that you're implementing? It doesn't make sense. The more states that actually reject the state exchange, the better chance we have of forcing Congress to reopen this issue. They would have to update, repeal, or replace Obamacare because of a glitch in the federal law. Also, the court will look more favorably on the 26 states' argument against the law when they take testimony in March. And to me, that sounds like a good plan.
Basically, what is an exchange? An exchange is a mechanism that was created under the Affordable Care Act to do a number of things. To allow individuals to apply for Medicaid, to allow them to qualify for health insurance premium subsidies, and also to purchase health insurance. There's also a program that would specifically address small businesses purchasing insurance on behalf of their employees. The exchange requirement is already existing under federal law. Unless that law is struck down or repealed, it will take effect. That law requires that every state have an exchange, either one that's set up by the state or one that's set up by the federal government. The strongest concern that the department has is that if this bill goes forward, if state agencies are not playing any part in the implementation of a federal exchange, which would be what would happen if the bill goes forward and there is no state exchange, there would be very significant federal involvement in an area that has traditionally been regulated entirely or almost entirely by the state.
Supporters of implementing a state health care exchange claim it will help the state maintain some control over our health insurance market. This assumption is flawed on many levels. First, of course, the idea that maintaining a semblance of state control rather than waiting for the mandated Obama administrative exchange is attractive, but by adopting our own state exchange, we would be agreeing to pay for the cost of administering that exchange after a certain year. Second, the promise of federal money can be attractive to state budget writers, but most often that money comes with strings attached, as is the case with healthcare exchanges. By implementing a state exchange, we accept the terms of the federal government that any exchange may not establish rules that conflict with or prevent the application of regulations promulgated by the Federal Secretary of Health and Human Services. We also would be enabling the individual mandate, which we have insisted repeatedly is unconstitutional. Further, given the strong possibility that the U.S. Supreme Court could find Obamacare unconstitutional, it makes no sense to spend time and taxpayer money now to begin the implementation.
If Obamacare is determined to be unconstitutional, it's unconstitutional. It's not going to go forward. But if it does go forward, I think it's incumbent upon this legislature to be ready. And I testified before you this morning as a small businessman. Most of you know that I'm an innkeeper up in the North Country in the smallest town in New Hampshire, Hart's location. And we have just a few employees. We used to have more full-time employees, but we cover healthcare, or help to cover healthcare costs, healthcare insurance costs, for our full-time employees. So we found a way to reduce that number in order to be able to afford the high costs of healthcare. I've heard terms like being business friendly in previous testimony because you want to hold back the tide of Obamacare. Well, I can tell you the current situation is not business friendly. You've heard me say before that our insurance costs have gone up exponentially in the 18 years that we have been in business here in New Hampshire.
But I think whether you think it's a good bill or a bad bill, you should nonetheless not want an exchange in New Hampshire, and you should not want the state government and the machinery of state government procuring or doing the legwork to put together an exchange in New Hampshire. There's a lot of discussion about whether or not we have, whether or not we're better off with a federal exchange. Let's say the bill isn't unconstitutional. Let's say none of it gets repealed. Let's say none of it passes. There's a lot of discussion about whether or not we're in a better position with a state-run exchange or a federally run exchange. And I want to address that issue because while it is true that there are some things that you can choose. It's like the old Model T. You can have any color as long as it's black. But you're also allowed to choose whether or not you have door locks or a speedometer on your Model T. And we're going to be allowed to choose things like that, but the engine is going to be the same, and the body's going to be the same, and the tires are going to be the same. And the federal government retains the authority to control all the dictates of all the important things and what the health insurance has to look like. And so at the end of the day, the question is, do you want a puppet government or not? And are we better off with a puppet government where whether or not the federal government runs the exchange in New Hampshire or they have a local agent running an exchange to the exact dictates that they supply is frankly immaterial. And at the end of the day, it's the same thing. Well, if it's immaterial, why don't we let it just go forward and have a local exchange? And it's actually not a bad question. There are financial issues with this, and no one is addressing the financial issues with this. The cost in Massachusetts of running their exchange, I think they call it a connector in Massachusetts, is something like $29 million. And that's under a plan. I don't want to get into debates which are going to be part of a presidential election about whether that's the exact same thing or not. It's not exactly the same thing. There are a lot of similarities between what's happening in Massachusetts and what the national picture would be like. But it would probably cost more to run it than it would in Massachusetts. Obviously, we'd be cheaper than that because we're a smaller state. But the cost of this would be tens of millions of dollars to run. And at the end of the day, although the administration will help at the beginning, the federal government will help at the beginning, they will not help after a certain point, and we're left holding the bag.
Clearly, there's a great deal of ongoing debate as to whether the federal government should be in the insurance business. That's an important debate. Listen to it, but that's not why I'm here before you. Candidly, Northeast Delta Dental did not support the Patient Protection and Affordable Care Act, but it's the reality. We've got to deal with the reality. It's made my personal life miserable. I work 7 days a week, 12-hour days to prepare for it, but we have to be ready for it. So again, we did not support the PACA. But no matter what one's view on PPACA, its passage in 2009 set in motion a course of action in the insurance market that today has real consequences for the people of this state, our great state, and our business community.
While the House Commerce Committee was dealing with the bill blocking health insurance exchanges from going forward, even at the bureaucratic level, the New Hampshire Senate tabled a bill that would have forwarded health insurance exchanges. We sat down with the sponsor of that bill, Senator Ray White of Bedford. We're speaking with Senator Ray White from Bedford about health care insurance exchanges. Now, you sponsored the Senate bill that would implement a state-based exchange. What was your thinking in crafting that legislation?
Well, I am, like most people on both sides of this debate, against the Affordable Care Act, so I want to be clear about that. And I saw Senate Bill 163 as a defensive mechanism to preserve the sovereignty of the state of New Hampshire, the philosophy of the state of New Hampshire, should we be forced to implement any or all of the Affordable Care Act. And so I'm concerned about four major areas. One is the regulatory authority of our state-based regulations, that being the Department of Insurance and Department of Health and Human Services. I'm concerned that a federal exchange might preempt them, whereas I'm trying to maintain control of our regulatory agencies in a state-based exchange. The second is I'm concerned about the regional carriers that we have that dominate our insurance landscape in New Hampshire. We have mainly, except for Anthem Blue Cross, which is a national company, most of our carriers are regional, and I'm afraid a federal exchange could harm regional carriers, and that only nationwide carriers are able to participate, and so that scares me. The third issue is that I'm concerned about the role of the broker in the delivery system, that perhaps, because I am a broker, I should disclose that, and I'm concerned that we could be replaced potentially with federal employees in a federal-based exchange. And then the last point is I'm concerned about, I guess I'll call it sprawl. My legislation envisions the subsidy-eligible population only in the exchange. I'm concerned a federal exchange may try to swallow the entire delivery system and all the populations, not just subsidy-eligible populations. So that's essentially why I feel a state-based exchange is to be favored over federal exchange, and I feel that's our best defense mechanism.
You've said you oppose the Affordable Care Act. You don't think it's a good idea. Do you think it's constitutional? Do you think it's likely to survive the legal challenge at the Supreme Court?
Well, obviously, I would hope not. I would hope that we get a decision as sweeping as the Florida Circuit Court that basically said not only is the individual mandate not constitutional, but because it's such an integral part of the law that the entire act goes away. That would be my favorite outcome. However, I'm afraid that other circuits have ruled more narrowly, where they've only judged the merit of the individual mandate and left the law intact. And of course, some of a couple of decisions weren't even in the direction I want. So we have not only a divided court about whether it's constitutional or not at the circuit level, but we also have divided even at the circuit level about the scope of what that means.
Representative Manous has a bill in the House that has some support. Says not only do we not want an exchange, we want to prohibit insurance and HHS from even moving forward on an exchange. They're worried that the state would do all the legwork and then the federal law would still end up trumping anything the state would come up with. Do you think the federal exchange would ultimately overrule whatever New Hampshire sets up?
That's a legitimate concern that those that support the Speaker and Manous's position that's a legitimate concern. Again, I think we're both trying to get to the same end game. I disagree with their legislation. I think it's too sweeping. I think interpreted the way I read it and the way it's written is that it would really preempt our Department of Insurance and our Department of Health and Human Services of just about any operation that has anything to do with anything the federal government dictates or funds. And really take them completely out of the ball game. I think it's way overbroad. I think my bill is a better vehicle to again present defenses for our sovereignty and our way of doing things in New Hampshire. Again, it's a philosophical difference. I think the end game from both of us is the same, but the means to getting to that point is where we disagree.
And how did the Senate deal with your bill this week?
We retained the bill because there were some questions about the bill from some senators, and so rather than just force something through on perhaps a narrow vote of 13-11 or whatever I could prevail with, prudence dictated that we should retain the bill for a period of time to answer some of the questions that some of the senators have.
Would your thinking on this change if the Supreme Court came down with, let's say, the decision you're hoping for?
Yeah, my bill envisions that, and because I have, I'll call it a poison pill that basically gets rid of that if that happens. Now, there have been some criticisms of my bill that the poison pill is not strong enough, and I'm open to that criticism and willing to amend the bill to make the poison pill even more explicit to those that have, because I do have people who agree with me and support my bill, what they've told me that they think that needs beefing up, so I'm willing to do that.
Senator, thank you for joining us in the Cloakroom.
Thanks.
The bill blocking health insurance exchanges in New Hampshire now heads to the full Commerce Committee and then likely to the House floor. I'm Grant Bosse. Thanks for joining us in the Cloakroom.